think we are live. Awesome. Guys, come on for a little between Christmas and New Year's live session today. Whether you're live or watching after the fact, you can always post any comments that you've got here. If you're struggling with your back pain, your herniated discs, your sciatica, we're here to help on this particular session. I'll be talking through a couple of bits and pieces about that tension that a lot of you guys will feel when you have a lower back injury and you're starting the rehab. Hopefully that's going to help give you some of you guys confidence going into the new year. And for those of you that are members as well, we're going to be going through a little screen share a little bit later on, just to talk about, or a reminder rather, of where certain things are in the program. And obviously for any of you new guys that are joining for the first time, then you can always have a little sneak peek behind the curtain of what's involved in the membership and what you can look forward to if you are working with us going into the new year. So with that out of the way, one of the most important things that people struggle with when they have one of these little herniated discs in the lower back, maybe it's not a full herniation, maybe it's just a disc bulge or anything like that, or maybe it's some degenerative disc disease or some other kind of diagnosis, is that there's this fear around what should I be doing? And so often people will gravitate in first instance because you feel like you can't even trust your own body. You're moving around on a daily basis and getting a flare up here and a flare up there and you don't really know why. So you kind of gravitate to, oh, well, I'll just do nothing, or I'll take a step back, or I will maybe go and see whoever and get given some light stretches and those kind of things to do to try and help this issue down here. And maybe at that point, you don't really know exactly what the issue is, or you know if you've got some back pain, you've got some pain going down the leg, maybe some sciatica, and you've read online that might be the situation. I know for many of you guys, you've actually had the investigations, you've had the MRIs, you've had the imaging, and they've said this is what's going on, and you know it's a herniated disc. You know there's something wrong down there, but naturally still you're fearful. And one of the big issues that often happens for so many is that you get this negative relationship with rehabilitation work because the rehab work that you've been given hasn't really been rehabilitation work. You might have been given some knee hugs, some child's pose, some cobra, right? All of this stuff is just bending and wiggling this lower back more. Right? It's not actually doing anything to provide solutions. Sometimes you might have been given maybe some of the right exercises. You might have been given squats. You might have been given dead bugs. But on those exercises, say for example, the squat, you got told to, pelvic tuck and then do the squat. Or on the dead bug, you got told to flatten your spine into the ground and then go through the movement. And these are incorrect technique. And who are you to know, really? Who are you to know that that is not the way it should be done? But that might often be paired with other stretches. And so often people go into their, they're going into their specialist, the GP, the doctor, the physio, whoever, and they're finding that the rehabilitation work they're given, it's not rehab. It's just a pick and mix selection. I say sometimes it's a shopping list, right? It's a shopping list of stuff to do to kill the time while your back is trying to go through a healing process. And therefore it's purposeless. It has no real purpose. It has no real focus, no goals, no aims. And it's certainly not progressive. And so you become disillusioned. What have we got here from Bowman Fitness? It says, is it possible to get rid of sciatica for good? If so, would you say it's the norm for most cases? It is perfectly reasonable and possible to recover from an injury that causes sciatica. That is certainly possible, certainly reasonable. No more than it is possible to recover from a sprained ankle or anything like that. The biggest challenge with lower back issues, and sorry to go off on a tangent, but it's relevant to the comment, so we'll run through it. The biggest issue with lower back issues is you can't be taken out of the equation. Like we've got guys that are, they've got a lower back issue and they're still driving every day. Well, if you had a sprained ankle or a damaged ankle, it's in a boot, you can't drive. So you have to go through the process of getting it strong again. And you can have that period of protection, let's say, removing you from the equation for long enough for the body to actually go through a significant amount of healing and rehabilitation. And then you can get back into things in some way, shape, or form. And you've got a second leg to lean on, or you've got a second arm to lean on and use in that time period. But for lower back, and so often, the early intervention does not respect the fact that you can't actually isolate that lower back. And it's certainly not advisable to go for extended periods of bed rest either. So you have to learn to manage it very quickly. And the guidance and advice there is very poor. I'm sure we can all think of scenarios in the real world, in our jobs, in our daily life, where a problem, if dealt with immediately with the correct approach, can be no problem at all. But equally, that very same minor issue, fundamentally, when dealt with badly, can turn into an absolute catastrophe that feels like it's never going to end. And for so many, because the advice, the guidance, the support, the understanding that's imparted to you guys when you have a lower back injury is so poor, it's so easy for you to slip into that real problem long term. And What have you got here? Dean has said he deleted my comments. I don't have time to delete your comments, so if you posted it, it's probably been filtered out, I'm afraid, guys on TikTok. So hopefully that makes a bit of sense, right? The most important thing, I think, was in the question, though, for Bowman. Is, can you stop sciatica coming back? That mindset needs to change. You need to be thinking about, can I recover adequately from my injury? Sciatica is not an injury. Sciatica is the symptom that one suffers, right? Can I ever stop myself having a runny nose again? Well, that's not really what you're talking about. You're talking about recovering from a viral infection. And with back injuries, it takes people so long to actually get to the point where they realize there's an injury there and start talking about rehabilitating the injury. When we're talking about sciatica, and I was doing some research on this the other day, so many people that talk about sciatica are still stuck in the mind frame of the symptoms rather than the injury. And that's what perpetuates these months, years, even decade-long battles, which seem to be going nowhere. So it's the framing of switch out from sciatica and switch over to the actual injury and starting to talk about that a little bit more. And then we're going to have a significant, greater amount of success. We understand then what we need to do to build resilience. If we still think it's sciatica, anything that relieves my sciatic pain must be good, and that's not the case, because there are plenty of things that relieve your sciatic pain that actually are certainly not good at all to be doing. Because when we understand the root cause, we see, hey, that's not a good idea. Lily said, I've been off for 2 months from nursing. That's a tough job with a lower back issue. It is a tough job. Had a nerve block 2 weeks ago, but still having pain, pins and needles. We have to get on. So Lilia said, is it the best to go back to work? No. You know, get back to work and see how I go. That's not a strategic approach, Lily, I'm afraid. Now, you might have to go back to work, I'm afraid, you know, and that's just the way it is. More or less everybody in the membership in the program does not have the luxury, unless they are in dire straits, of actually stopping their job. They have to go to work in spite of the back injury, and they do the best they can. But Lily, the injection does nothing to the injury that's there. The injection does nothing to help the soft tissues. And in this time frame, we've probably been less active and therefore lost more control, muscle, strength, etc. And so we're going back to work less conditioned than we were before work. And before we had the injury, or the quote-unquote injury, we were stronger, right? And now we're weaker and we're going back to do the same old job. And we're deconditioned a little bit. So we have to go through a process of rehabilitation. We have to go through a process of trying to rebuild objective strength and resilience into that lower back. We have to have a plan. Too often, I use the example, I don't have any cuts on me because thankfully I haven't been battered too much at Jiu-Jitsu lately. But you guys will know, because I've mentioned it to you before, the cut that I had on my eye. It stops hurting long before the healing and strengthening process has taken place. And if you guys haven't done any objective strengthening, then you have no measure of how strong or weak that area is. And that's why rehabilitation work, such as the stuff we talk about, focusing on spine stability first, learning to stabilize and protect this spine, then building strength and resilience through this spine and these surrounding tissues with simple exercises that anybody can do, such as the dead bug, the marching bridge, the squat, the hip hinge, the step up, the single leg hip hinge. Those exercises are fantastic because they also give Lily an example of what she's competent enough to do right now. So with some careful work, Lily might find out that actually when she does a squat, it took her a few goes, but she actually managed to do it. And now with a 5 kilos, she can do a squat like this and she's okay, right? But when she tried 7.5 kilos, she kind of lost her form a little bit and it started to aggravate the lower back. And it wasn't really a technique thing, it was just the loading. The back just wasn't ready for that kind of loading. Understandably, right? It's not been rehabilitated. But in due course, over time, 5 kilos turns into 10, 20 and so on as we do our rehabilitation work. But if Lily's struggling with a 5 kilo weight or a 7 kilo weight, and then Lily goes back to work to just see how she goes and gets handed, you know, a 30 kilo tray, a 20 kilo tray, there we're going to get in a bit of trouble. A patient falls, has to catch them, now we're going to get in a bit of trouble because the weight difference is very, very different compared to what we are conditioned for versus what we are exposed to. And that's where people get caught out. If you don't do rehab, you have no idea how healed or strong the area of injury actually is. And so while many people will get away with it, we see this pattern time and time again of, well, it went away a little bit on its own, and then it came back, and then it went away, and then I had some treatment, and then it went away, and then it came back. And the answer here is always the same. What did we do for rehab? What did we get up to in our rehab? What kind of loads were we dealing with our rehab? And in almost all of those conversations, there's never an answer. And that's a great thing because it means there's a stone that you haven't turned over, that you can start to turn over and you can start to get better and resolve and support the healing that's trying to take place here. We just didn't know what we didn't know, and it's an honest mistake. You guys aren't supposed to be experts in every single facet of life. And so when the car breaks down, I go to the car guy because I don't know what's going on. If something else, the boiler breaks down, I go to the boiler guy. Because if I start fiddling around with things, I'm probably going to make it worse, right? And it's the same with the lower back. Why we're worried about doing anything different is strange. Why we wouldn't just go and get a little bit of support, you know? But understand what different treatments are doing. So the injection is not doing anything to build strength and resilience. If you're going over to YouTube, we've got a comment here saying, I have kicked out my L5 with 3 herniated thoracic discs. Pain sucks. I don't know what exercises that don't annoy at all. And the sciatica. You just got to start where you start, right? Some of you guys are going to have issues in various areas. It's very common to have an issue in the lower back and also have an issue in the thoracic spine or the neck, or to have an issue in the knees, etc. And you just have to start rebuilding resilience. And unfortunately, and I'm talking about this in an article that I'm working on at the moment, too many people have very, very poor conditioning before they injure themselves. And they think that something that's, you know, oh, now my back hurts, now this, that. But you've been managing to get away with things for too long without actually dealing with the problem, right? I use the example sometimes of the waiter, right? We've got a waiter walking through a busy nightclub or a busy restaurant, and he's carrying one glass in his hand to go over to the table, to go and give them another glass of water or whatever it may be. If that guy gets knocked or bumped, he might lose his balance a little bit, but he'd probably keep hold of the glass. Then we imagine the guy walking through the restaurant who's carrying on his shoulder 16 champagne flutes, all filled. And by the way, he's blindfolded with one eye, and he's roller skating backwards. If that guy gets knocked over, it's going to be chaos. And too many of you have had the experience over the years of one little incident leading to a cascade of chaos, because we've been moving through life not with any significant resilience. And as we discussed on a previous live stream, and it's the subject of this upcoming podcast episode, like in the UK anyway, 93% of men and about 95, 96% of women have not done resistance training of any substance for longer than a year. So no one in the population, more or less, is actually doing anything to build resilience. They built what they could do in their teenage years, and it's just been a downhill spiral from there. And then when you superimpose the instance where someone has a back injury, maybe like Lily, now she's inactive for a month or two, she loses muscle mass, muscle strength, ligament strength. The discs are ligaments. Coordination. All of these things get lost in a relatively short period of time, which is why it's so difficult to allow a patient, you guys, to get to the point where you go chronic. That means that we haven't really done anything productive in 12 weeks. And for many of you, you've moved well beyond that path, right? Because it hasn't been dealt with effectively. Just going back through some of the other comments, guys, because as you know, I can keep talking and talking sometimes on this stuff. So just looking back through here, guys, just keep them posting in. I'll try and get through everyone. Sorry, YouTube, for just staring at my forehead. Lily, see, this is an instinctive, thought. Would a back brace work, right? Would a back brace work? Some of you guys will be able to answer that question. Think about a back brace, right? We've probably got a lower lumbar issue, so we're probably talking about L4-5 and L5-S1. And I can say that with a degree of certainty because more or less 90 to 95% of your lower back issues are going to center around that area of the lumbar spine, the lower lumbar spine. How does a brace work? A brace works by spanning either side of a joint to create protection. We see this in the elbow support, the knee support, the wrist support. It goes either side of the joint. In the case of the lower back, assuming we are just a skeleton like this guy here, the lowest we can get the brace is going to be the L4 vertebral body, maybe over the disc, assuming we're a skeleton, which we're probably not. So realistically, it's probably sat here. We are not able to even brace the section that's injured. What we can do by bracing is restrict the range of motion here, potentially, assuming the brace is effective, and allow more movement to go through the injured segment. So the brace is an absolute incorrect thing. The worst thing about the brace is it makes you feel like you're actually more protected than you are. And so in individual, for example, the powerlifter who's using a lumbar brace to do an extra level of performance, right? And I make no bones about it. They do use them to get more performance out of the lumbar spine, right? But that individual already has spine control. They have it to a high level. What we're using here is a brace to try and protect an area that we currently don't have any control over. And the fact that it doesn't actually protect that area only serves to create a feeling of confidence that is terribly misplaced and allows us to, unfortunately, get worse and worse. And also, if we're wearing it for a long period of time, we're then taking off the strain on the muscles that should be actually doing some work. Tyler has said here, Right, I said doing core exercises. Yes, you need to do the right sort of strengthening exercises. Core exercises that are focused on stability rather than something like a Russian twist, which involves you flexing, forward bending, and twisting left and right. Those are going to be incorrect exercises. Spine stability work, a dead bug done correctly, marching bridges, your squats, your hip hinges, these are all exercises which force the core to be stable. Make no mistake, if your core, your midsection is not stable when doing something like a squat, the weight of your torso will cause you to fold over. When doing a step up, for example, tell me over on here, if you are not engaged, you're going to tilt the one side or the other, right? You're not going to do it correctly. You have to have a strong core. People sometimes ask us, and we have a dedicated unit in the members material where we talk about this specifically, right? The use of core exercises. People too often think core exercises is something you do in Pilates, but don't understand that a core exercise is a squat, a hip hinge, etc. What else have we got here? Someone said, I had a quarter equina syndrome, but still pain after an operation. Why have I still pain? Is it in my head? No, it's not in your head. It's not in your head. Because the quarter equina syndrome. So if we take a step back to understand what quarter equina syndrome is, so what we've got here is the disc herniation going backwards. That is the injury. And if we are more specific about what the injury is, in the case of Power Mindset Girl with her quarter equina syndrome, that is not the injury. The injury at its root cause is a failure of the annulus fibrosis, generally speaking. Now, there might be other factors here, like, there's some spondylolisthesis, there might be some degree of facet hypertrophy, etc., other factors, but fundamentally, we have a failure of the ligaments, because it is the ligaments that provide integrity to this segment. And if we take the disc example, the disc herniation example, which is one of the causes that we might have, and maybe Power Mindset Girl has had a lumbar discectomy, for example, or a laminectomy or something like that. The annulus fibrosis failed and allowed this to break through. So that is the injury. When you have the quarter equina operation, it's nothing to do with the quarter equina fundamentally, in so much that they're removing this that is pressing on the quarter equina. The quarter equina are just a specific collection of nerves that go to the bladder and bowel. And the reason one could make the statement that the reason it's an emergency is because you being forced to self-catheterize for the rest of your life is not very good for quality of life. It's not at all. So they want to make sure we can try and eliminate that. Are you still going to have pain? Yes, because nothing's been done about the injury. The quarter equina is the symptom of the injury to the back, and it just so happens to be unlucky enough to pressing on specific nerves that we do not want to be long-term affected. And that's why it's done in an emergency scenario, for example, right? So understanding that you finish the operation, it's a big shame if the expectation was that, and it's, well, not a shame, it's more than a shame, it's a miscommunication. If the expectation was you're going to have this operation, it's going to take everything away. No. You have to do the rehabilitation work now. You have to strengthen up. And unless it was a traumatic incident, and by traumatic I mean like a car crash or something like that, then it's probably been a case that the symptoms have been worsening, or the back issue has been worsening over an extended period of time, and it's led to the crescendo of the quarter equina symptoms, which have led to maybe an emergency surgery or a scheduled surgery. So it's been going on for a long period of time. So all those factors that I mentioned a moment ago about the deconditioning, etc., still are true. And we have to do the work afterwards to do the rehabilitation, to rebuild strength and resilience in the lower back. Storyteller has said over here, and stay in the vortex, has said, much love from Texas. Thank you. Appreciate that. Storyteller said, I made progress and improved my sciatica 85% by the progress on seated good mornings and holds for 15 to 35 seconds, but I went to 40 seconds and I had pain. What should I stick to on progress? I don't recommend holds. I think holds are like, they work, but they don't give you any meaningful understanding of how strong your back is. It's very difficult to apply that. I mean, I'm all for simplicity. So I would suggest hip hinges. I mean, you can still do seated hip hinges with a load. That's fine. I just don't think that's a very accessible exercise for most people. So I just say a standing hip hinge is better, personally. What else have we got? I have had MIS for herniated disc, L5S1, I think we probably mean. Oh, on the 15th of the 12th. MIS meaning minimally invasive surgery, I assume. Is there any recommendations for exercises at the moment? I'm assuming it's the lower lumbar spine disc, in this case for KA04. In that scenario, I would suggest that you want to, 12th and 15th, we should already be doing rehabilitation work. And it should be focused around a neutral spine. It should be stuff that's teaching you how to protect that area that you've had the operation on, right? Because remember, when you have the minimally invasive surgery, normally it's a microdiscectomy or something like that. They've just removed this bit of disc. They haven't done healing. So you need to make sure that you can create protection around here. You'll see we've got videos on it because it's such a comment. is that, well, I had my microdiscectomy at L4-5, and then my L5-S1 went, and I had to have it there, or something like that, right? Or I had it on L4-5 on the left, and then it's on the right. Why? Because we haven't actually addressed the factors. We haven't actually rebuilt strength and resilience. We haven't actually rebuilt control. So we've continued after the surgery, especially in the scenario where we feel better after the surgery, which is a good thing, right? But it's a double-edged sword if you don't understand it. We then, oh yeah, look, I can bend my back again. So we're doing all this kind of stuff all over the place rather than just learning to move more appropriately, right? So the neutral spine stuff, so important. Storyteller said, reps give me pain. I would leave out this, I would do standing hip hinges. Standing hip hinges are much, much better exercise. What's probably happening when you're doing that is that you're actually rounding your lower back. You're just getting away with rounding your lower back. Because a lot of people, so for most people that come into the program, maybe like, for example, KA04, right? He's just had a surgery, or maybe he hasn't, maybe he's recovering, whatever it may be, right? For most people, when they do a hip hinge, they can't necessarily go too far. And my hamstrings are killing from Jiu-Jitsu the other day, but they can't really go too far, right? They may be stuck here. So the notion that that's as far as you can go on a standing hip hinge, that you're going any lower than that on a seated hip hinge, you're probably just rounding your lower back. By definition, when we're sitting down, we're generally speaking eliminating the lumbar lordosis. So what you're doing is getting away with rounding your lower back for, 15 to 35 seconds. Not ideal. Do a standing hip hinge. Start where you start, right? You might start with, like, sometimes people feel like it's a bad thing. And we get members, right? They'll go, oh, I can do a squat. I can do my squats with 5 kilos to here, but I can only do a hip hinge to here. Fine, that's where you start, right? That's where you start. That's where you have to start. And then you go from there. You just have to start, right? And you'll find that the squat progresses on further, but as the squat progresses, you find that the hip hinge starts to improve. Your ability to perform the hip hinge improves. Storyteller said, my spine is straight like a pole while I hinge. Okay. But I would suggest it's probably not, because if it's straight like a pole and doesn't have a lordosis, then it's not straight like a pole, it's flexed. The spine should not be straight like a pole. The spine should have a lordosis to it. So that's an important point of reference. We've discussed that on, go and have a look at the last live we did, where we talked about the x-rays and the curvature, you know. There are some people that are stuck in a flexed position. So we're actually not, we shouldn't be straight like a pole, we should have a lordosis in the lumbar spine. So something worth bearing in mind there, guys. What else have we got over here? And guys, just keep the comments coming in. I'm going to go for about an hour, so we're 22 minutes in. Hopefully it's been helpful for you guys. I can see there's a lot more comments over on TikTok, so I'll keep rolling through there. And those of you guys that are on YouTube, got any questions, comments, anything like that, you can post them in the comment section, and I will get to those. I want to know, when does this part go away? Is it a good or bad sign? Loza, I'm not sure which part we're talking about there, I'm afraid. I've had the same thought, it's kind of scary. Where are you based? We are in the UK, in Cheltenham. We've got full details on the website. Just go to the link in the profile page. Tyler said, it's like muscle is guarding because of the injury. Like, one of the things that people will report is that, for example, with a hip hinge, when they get to a certain point, everything tightens up, right? Because that's as far as they go. Now, on the one hand, it could be that the muscles are tightening up because they know that if you go any further, you're going to get in trouble, right? So it's almost like a subconscious feedback loop. In some scenarios, when we have lower back issues down here, those nerves that come out of this section, they control the glutes, they control the hamstrings. And so it's extremely common to have some element of dysfunction in those areas. The paraspinal muscles at the level that's been injured and maybe just adjacent above and below are commonly involved in these injuries. If we use it, because people get confused about this with lower back pain, but if I use the example of how you can get hip muscle spasm and QL spasm from a simple ankle sprain, you can start to appreciate it's not a big deal. Like, it is what it is, right? Because you're holding yourself in a funny way because you've got an injury. As you deal with the injury, these things subside. So, bear with me. If I sprain my left ankle, many of you guys will know this, right? Maybe it was a night out. Maybe it was just innocently walking a dog. Whatever it is, right? You sprain your left ankle. Oh gosh, goodness me, right? I know I've been there, right? What do you immediately do? Take weight off this leg. So I immediately go like that and I lift this leg, okay? Now my hamstrings are going to be tight, my hip flexor is going to be tight, and I'm leaning a little bit to the side so my QL is going to be tight. And then I'm kind of hobbling around like this for a while. Whenever I get out of a chair, I had this experience back in June with my meniscus on the left. I will have had muscle spasm in a number of different areas away from the actual injury. So in this case, I've got an ankle sprain, but I've got hip flexor tightness. And you go to your osteopath, your chiro, your physio, and they make a big deal out of the tightness. as if it's some sort of causative factor. No, it's a perfectly reasonable explanation. You've got an injury and you're trying to take weight off one side. You've got an antalgic posture and maybe some of the mechanisms that I mentioned with regards to the spine telling those muscles to tighten up. And too many times they go, oh, those muscles are tight, your hip flexors are tight. Yeah, because I'm lifting my leg up. As my ankle heals, I won't need to do that anymore, and then I can stand on it properly. And sure, I may need to do a little bit of cleaning up afterwards, right? Some stretching afterwards further on down the line. But just constantly trying to stretch the thing that's tightened up can sometimes be more of an irritation than anything else. People get too caught up in the antalgic muscle spasms that they have, or rather the antalgic postures caused by the muscle spasms that they have, maybe consciously or subconsciously. And they start trying to deal with those, and that's where you guys get drawn into the funny stretches and quirky pigeon poses and the hugging the knees and the figure four and the piriformis and all that kind of stuff. And they're just distractions. Because if you just acknowledge those muscle guarding scenarios, those dysfunctional muscles, those sleeping glutes or glute amnesia or other bits and pieces that you might have heard, the buzzwords, right, that sound really interesting and catch your attention, and you suspend disbelief for a moment and just focus on rebuilding the strength of the lower back, you find those things go away. And there might well be a few things. Do you know why? Because most of us, even before the injury, had some element of asymmetry. Most of us will sit habitually with one leg over the other. Ladies, especially if you've had children, will carry the child on one side and stick your hip out. Most of you will copy mum or dad who have the same sort of postures. You see this when you see patients that bring their kids in and stuff like that. You think, oh, mum and dad stands exactly the same as little Jimmy or little Sarah or whatever it is, right? Because we copy. And so those variations in muscle tension were probably there beforehand. Almost certainly were, and almost certainly will be. Very few people, when standing in the queue at the shopping, especially maybe these Boxing Day sales and everything else, are stood like a soldier. No, we're leaning on one side. We're a bit like that. One side, maybe the other, right? And so this side tightens up because I'm always weight bearing on it and using it to rest on the ligaments or tendons of the muscles. And this side is a bit more loose and free. Everybody can relate to this. Everybody, when we take a step back and think about it. But we only think about it when we have an injury and we start going searching, what can I do to make myself feel better? And then you see someone who starts making a big deal out of it and this, that, the other, and you go down a rabbit hole of stretch, and it doesn't lead to anywhere productive, unfortunately, in too many cases. I hope that makes sense, guys. It is a little bit of a ramble, but I think so many of you guys it will be relevant to. Loredana has said, any advice for childbirth injuries related to trapped nerves, fibrosis, adhesions, vein compression? I'll be honest with you, that might be a little bit outside of my remit. The biggest thing I can say to help those of you guys in that scenario, ladies specifically, post childbirth, is just give yourself a bit of grace and time to go through the rehabilitation process, especially if it's your first child. You're going to have a lot of things going on. If you've had C-sections, things like that, just give yourself the time and then try your best to fit in some element of rehabilitation to rebuild strength and resilience in that lower abdominal section. It'll be great for you for the long term. And too many ladies, you speak to them in their 40s, 50s, 60s, etc., and they think, oh, yeah, do you know what? It goes back to that pregnancy. I didn't really get a chance to look after myself afterwards, and it's sort of 1 week blends into the next, and before you know it, you haven't managed to get any work on yourself done, and that's tough, right? It is tough. So just do your best to do the rehabilitation work afterwards. The other stuff, fibrosis and adhesions and that kind of stuff, that's a little bit out of my remit, but certainly from a rehabilitation point of view, just do your best. The better condition you can be in before childbirth, the better time you're going to have afterwards, generally speaking, on balance. And just try and slowly get back into your rehabilitation work, starting with controlling the midsection, re-establishing your connection between your brain and your abdominal region, which has been changed quite a lot over the last 9 months, and then go from there. It's the same sort of stuff, same sort of rehab stuff. It's just those extra considerations. Paul has said, I watch you all the time. Thanks, Paul. Appreciate that. I have lots of sciatica in the hospital. Won't help me. We've got to do the rehab work. Paul, hopefully some of the messages come as, has been there, taken on board. We've got to do the rehabilitation work. The hospital can't help you, right? The hospital's there. If we're going to A&E, they're there to help you in that moment, give you some painkillers or whatever it may be, but they don't have the facility to do rehabilitation work. And so it's the wrong, it's the wrong place, to go, I'm afraid. Like, you need to go in those emergency scenarios, but they're not the people that can help you, I'm afraid, It's like going to see, calling the plumber out because you've got an IT issue. He's like, I'm here, but I can't really do too much, right? And that's just the way the system is over here in the UK, unfortunately, right? But you can start to get some real power back if we rely on ourselves, educating ourselves, and going through that rehabilitation process that we talk about. And I would suggest, Paul, if you haven't seen it, guys, those of you on TikTok and on YouTube, guys, the masterclass is a good place to start. We will be refilming that in the new year, but the masterclass will give you a big overview of, you know, starting to take back a bit of agency over the problem. Because I say it all the time, and I don't say this to be condescending in any way, but back pain is a you problem. And the people that struggle with it most are the people that are trying to get someone else to fix it. It's a collaborative effect. It's a collaborative affair. You are working with someone to help you help yourself, right? With a bit of guidance. If you're just saying, hey, John, here's my problem, fix it for me, off we go, not gonna work. Not gonna work. Because you have control over your lower back for too much of the day, too much of the week before you go back to see the specialist. Let's just suppose you're having something like decompression, you're having it once a week, twice a week, 3 times a week. Okay, that's 90 minutes. 90 minutes of someone doing something to you from a decompression point of view, let's say. Or maybe you're seeing your physio and they're doing some physio, some soft tissue work. Or maybe you're seeing your osteopath, your chiropractor and doing some adjustments. 90 minutes. If you're going 3 times a week for half an hour appointments, and that's half an hour of treatment, right? How does that offset 168 hours of you being at home, doing your own thing, walking the dog, getting changed, having a shower, doing all those other sorts of things? Someone said here, nerve glides make more flare. Yeah, nerve glides are not helpful. Like, we need to understand what we're doing when we're trying to do a nerve glide. You're trying to create the longest possible route of the sciatic nerve, so from the brain stem all the way down to the foot, and then trying to wiggle it, right? How is that making things stronger? How is that improving any markers of load bearing? It's not at all. It's not at all. And worse still, what are you doing when you do that? You are getting into a position, necessarily for it to work, you have to fully flex, you have to look down, you have to straighten the leg, and then you do something like that, right? I'm gonna get my abs cramping up if I do that for too long, right? But you're having to maximally flex the lumbar spine. So those of you that do find it relieving, you know, fine, but that's actually worse than if you don't find it relieving, because at least if you don't find it relieving, you realize that it's a bad thing to do, right? But all you're doing is maximally flexing that lumbar spine. That's what caused the problem in the first place. Load bearing on the front portion of the disc, now it's herniated backwards off to the left or right hand side, it's hitting that sciatic nerve, and then you get told to do more of that to glide the nerve or whatever that means. We've got videos on nerve flossing where I put some funny things on my head and around me to illustrate, you know, what we're doing here. But nerve flossing is not rehabilitation. I think the only reason it really helps some people is just by virtue of the same thing as a knee hug, in that it just opens out the spaces where the nerves come out. And that feels nice, but it's making the problem worse. And anyone that's got any questions on why that is, do ask. What's we got here? Can sciatica cause shin splints kind of feeling? It can be painful. It is not uncommon for people to get this burning type pain down the side here. Almost feels like a copper wire. That's one example, right? But once you know you've got that injury in the lower back and you've got that sciatic type symptoms, right? You need to now focus on the rehab. The symptoms are going to vary. We might get centralization, which is where the symptoms recede back up the leg into the lower back. We might not get that. But don't worry about that. Focus on the rehab, because the rehab becomes the thing that you focus on, because it is progressive and you're improving as you go through it. So when you start out and you're struggling to perform a squat and you're rounding, or you can't do a hip hinge because you're kind of diving forwards, and then you start doing a really solid hip hinge and your squat's really good, and then you go and start playing around with weights, and then you progress on and you've got 20 kilos here and you're doing your squats and you've got no pain when you do those, no symptoms when you do those. You can clearly see the improvement that has taken place in your lower back's health and resilience. And you have a number that you can put on that. You don't get a number when you just can do a knee hug. And what you'll find, by the way, is when you get to that point, at some point along there, you'll be able to do a knee hug and it won't hurt. You'll be able to round your back and it won't hurt. That doesn't mean you should continue to do the rounding of the lower back. That means you continue on your rehab. But the rehab should be the measure with which you are measuring your progress. And you will notice as you improve on your rehabilitation, your symptoms will subside. Sorry, you don't get to choose the rate at which that happens, because there are too many other variables at play. Someone, they've got 2 young kids that are under the age of 2. Someone else, they've got a job, they've got to do this, that, and the other. Someone else, they're a nurse, like we were mentioning earlier on. So we can't control for all of those variables, because no 2 people are doing the same things. So understand and take the variance, you know, in your stride, but lean on the guiding light, the guiding North Star of your rehabilitation progress. And if you're not progressing with your rehab, ask yourself why. That's why we have the support in the members area to help you guys go through. Get the videos in. For example, those of you guys that are members of the program, you should be recording yourselves, right? it's a learning experience, if nothing else. And also, it's so great to have that video and go, gosh, is it any wonder I'm struggling to get better with my lower back? I look like I'm about to fall over. I'm that uncoordinated. And then you see, even a relatively short period of time, a couple of weeks, the transformation in these sorts of scenarios. What else have we got here? Just looking through the comments on TikTok as well. Nirav has asked, when do you know if you need to regress the current load for rehab? As you recommended, limitless, that recommendation was just to do it over the next, over this week, right? So just little daily updates, that'd be really helpful. I did see that post just before we went live, so I haven't had a chance to digest it fully. So I will comment on that a little bit more. But with regards to regressing the current load, if you are getting aggravation during, now I actually started out today's live stream talking on this and I didn't get to finish it because I just got into comments, right? And I think following on from this in the members area comments will be most helpful because it needs a bit more discussion. But one of the things I caught in the comment was, I feel some tension as I go to get on and pick the bar up to get ready to go. And the answer there is, that's not really a problem, right? It's not really a problem. If you're getting numbness going down the legs or numbness in the feet, and I forget the exact makeup of the previous scenario, because we had a scenario before where we weren't able to do the exercise without like tingling and other bits and pieces coming on during the exercises. But now we're able to do that. Getting tension in this area when we are doing squats and hip hinges, especially as we start to progress on, is not a problem at all. It's not a problem. Right? We need to maybe manage that, and that's the utilization. I don't have it with me. The massage gun over those areas to help manage that stiffness. Maybe even doing a bit of massage gun beforehand can actually be a really helpful strategy to warm those areas up a little bit. It's pretty cold right now. It's pretty cold. It might even be that we're coming to the exercise. Maybe we could be a little bit warmer, right? Using the massage gun before you start the exercise is a nice little test. But in terms of regressing the load from a rehabilitation point of view, we should only really be doing that if we're getting specific aggravation during the exercises. And feeling the lower back musculature working, I wouldn't classify as aggravation in that particular area. Feeling tension in the lower back musculature. For example, I'll use a good example because my left arm's a little bit weaker than my right. When I started doing chin-ups with a loaded weighted vest, so I've been using 20 kilos, I'm going in for the chin-up, I'm coming up like so, and then back down. I could feel my left lat was like way more tense than my right because it was weaker, right? And now I can go and do that, and I'm not noticing as much of a disparity at all because it's catching up, right? It's not unreasonable for us to find that one side of our lower back musculature is a little bit off, a little bit weaker, a little bit more vulnerable, or a little bit more, it's having to play catch up to the other side. That's not necessarily a big issue, it's just something to notice, right? Take note of. Muscles in this area. These guys are working hard, right? These guys on the back, on both sides, but one side may well be a little bit weaker. And as we start to get the load to the right kind of level, we start to become aware of that a little bit more, right? If we pick up 5 kilos on the biceps and I start doing bicep curls, I don't really notice the difference between my left and right arm. But if I pick up 20, 25, or 30 and start doing it, I notice there's a big difference between the left and right. And so it might be a function that we're noticing that a little bit more because we've got up to about 40 kilos or 37 kilos on the hip hinge. And that's not caused necessarily to revert in this sort of scenario. I'd first be looking at the daily activities and those kind of things as options to revert. And looking at see if we can do better things post-workout to help aid the recovery process, as in the recovery from the workout itself. Just looking over here, Patrice, herniated L4-5, horrible pain, affecting the ribs, arms, etc. Nothing on MRI for T10. I'm not so sure about the exact details here specifically, but L4-5 disc herniations don't cause any pain in the arms or ribs, generally speaking. So there might be some confusion around things that are going on there. There might be some extra issues going on there as well. If you're getting stuff in the arms, typically speaking, that's going to be a referral from the neck as a general rule. And that's what I'd be looking at. And it's certainly not uncommon for people to have lower back and neck issues simultaneously. What else have we got through here? Just coming back through the comments. Do you recommend squat and hip hinge in the same workout? So the way in which we structure it in the program is that you guys do the squat and the hip hinge together when you are starting to learn these exercises. And that's primarily because you're not actually challenging yourself at an appropriate level. Most of the work is on a technical basis. You're trying to improve your technique. on these exercises. As you get later on in the process and we're starting to use heavier loads, you split them out, right? Even from phase 2, we split them out into 2 workouts. Phase 3, they're 2 workouts. Phase 4, 2, and they're separate days. They're separate days. You wouldn't be doing them in the same workout, generally speaking. What to focus on for L5-S1 healing 4 months post-operation? Spine, stability. Learning with movements like the squat and the hip hinge. Dead bugs and marching bridges are great other ones as well. To start to learn how to stabilize this lumbar spine. We should have started a little while ago, right? But we need to learn to stabilize the spine to protect that L5-S1, right? And then the fundamental reason that we're doing that work, learning that control of the neutral spine, learning how to do these exercises in easy forms, is so we can take them into a workout to use those same exercises to build resilience. What we're trying to do is we understand that we had a disc that was uninjured for a long period of time. And these fibers have adapted to, if we've been doing training, which many people haven't, unfortunately, in the uninjured spine, these fibers, the segment has adapted to strain over time. It's got stronger over time, and then it's been injured. We need to appropriately build it back in terms of build its strength back up after, whether it's an operation or whether it's not. We need to help support that healing process because healing turns into strengthening. When we talk about a wound like my eye, whereas it doesn't need to really do any strengthening, right? It's soft tissue, it's elastic, it's not going to get challenged. But when we're talking about structural joints or structural tissues or muscles or tendons, we have to go through a strengthening process. And so you're learning a technique to stabilize the spine so you can use the squat and the hip hinge are 2 iconic ones. They're probably the best. To be able to safely and reliably apply load to the spine so that you can build strength in that spine, in the target tissues. So when, for example, Lovely Latte, I think, or Love Latte, when Love Latte, after the operation at L5-S1, goes from being able to squat 5 kilos and no more to being able to squat 50, 60, 70 kilos without aggravation, as we see time and time again, it just takes time, right? It is objectively true that that segment has more load going through it than it did when you were doing 5 kilos. And if we've done things correctly, we will have realized that when we were doing 5 kilos, we couldn't actually do 10, or we couldn't actually do 15. It would cause that disc, that segment to fail, to start to become irritated, etc. And now we can, and that's where you see the benefit. But the important thing is that this happens over time. It doesn't happen over a session, over 2 sessions, over 3 sessions. It happens over a period of weeks, providing we've done the work to get the appropriate technique to allow us to train at the appropriate level. This is not a get fixed in 30 seconds thing. This is about properly rehabilitating a weak, vulnerable, injured area of your lower back for the long term. We don't subscribe to doing funny little gimmicky quick fixes and this, that, the other. It's about properly building resilience. It doesn't happen overnight. And the expectation that you're going to try a squat for the first time and tomorrow afternoon you're going to be feeling better. No, it's not going to happen, right? Because we're talking about actually rebuilding the body, and we are constrained by biological limitations of the rate at which tissues adapt to strain. But you first have to get to a point where you can safely expose those tissues and joints to strain without falling apart. And by falling apart, I mean you technically falling apart. So it's important that we structure these things correctly. It's not overly complicated, but it's necessary. So following on from that comment, said the physio recommended only bodyweight squats first. Is it okay to start weighted squats now? The answer to that question is no one can give. You can't answer that. I can't answer that. But here's some things to think about, right? And it's perfectly correct to recommend body weight only squats, right? Because you want to learn in the safety environment. For many members, we will see that they actually have to start with a squat where they're holding on to something. And they need a bit of support because they're actually a lot weaker. They can only go to here. It needs to be a squat with correct technique that does not aggravate. And so assuming that that marker, those 2 checkpoints have been checked off, and we have a squat that doesn't aggravate, the next thing we do is, it's not about a month or not. It's about time, right? It's about technical competence. And so then you test, right? If you're technically sound, then you test. Because here's an example. One day you might have done the squats shirtless. And next day you might have done the squats in a jumper. You had weight on one that was greater than the weight on the other. It was a small amount, but it was weight nonetheless. The question, even a month ago, was not should you use weight or not. It was how much weight can you tolerate right now? Now, when you're first learning technique, you don't need to worry about running that experiment, which is why we structure things the way in which we structure them. You don't worry about that. But at some point, and I would argue sooner rather than later, especially once you've grasped how to perform the exercise without getting aggravation, and you can do it technically correctly, those 2 points need to be met, because sometimes people can do them like this and get away with it, but the moment you give them weight and they do this, we have a very large problem, right? And so the question is, well, let's find out. That's why we do discovery workouts. That's the way we structure the program, phase 1, phase 2. It's about technically getting competent, getting sound, with very low risk movements. And then phase 3 is about testing, right? That's all you can do. You just test, you pick out a couple of weights, you be conservative, right? And then you see what you can do. It's that simple. Amin is at herniation L4-5, touching the nerve, 1 year weakness in the left leg, knee pain, best conservative route. Exactly what I've just mentioned, Amin. Exactly what I've just mentioned. Now, if you guys need more support with this, you need help with this, if you're over on TikTok, send us a DM. If you're on YouTube, do a post in the comment section, whether you're watching this live or watching this after the fact. If you need more help, if you've been struggling with this for a long period of time and you've been going in different directions, you can't see the wood from the trees, then check it out. Send us an email, send us a DM. You can just go up to the profile bit up here if you're on TikTok. Guys, it's been a long one. It hasn't been that long. Oh, 46 minutes. Okay, we've got a little bit longer. And then we'll call it a day. Hopefully this has been helpful for you guys. Thanks, Cynthia, for the thumbs up. Thank you. Hopefully this has been helpful for you guys. I'm just having a look to see if there's any more comments. This is a great one. Jordan has said, how to know if I'm making progress? Exercises are getting easier and not aggravating. However, getting the same symptoms. We don't know how healed we are unless we test. And for most people, not for most people, for everybody, you don't get to choose when the symptoms go and at what rate they go at all. All you can do is progress your load, right? The exercise getting easier is quite irrelevant, right? If we're finding the exercise is getting easier, that's not what we're looking for. Because that to me implies we're doing the same exercise, we're just continually doing them. And that implies we're not actually doing anything progressive, right? If the heaviest load so this is very important numbers for you guys to make note of. If you're trying to recover from back injury, specifically to Jordan's question. Or Jord and Susa, anyway. What do you currently weigh in kilograms? Take 20, or pounds, whichever. Take 20% of that figure and 45% of that figure. That is the extra load that you apply to your spine when you sit down versus when you stand, roughly speaking, depending on how you sit. And so if we've got a lower lumbar issue and our rehab, for example, in this case, we're still using body weight, or we're still using 5 kilos, 10 kilos. If you're my sort of size, maybe a bit bigger, maybe a bit smaller, those figures are 20 kilos and about 45 kilos. If you're still messing around with 5 kilos, is it any wonder you've still got symptoms? You know, if you're sat down with your dinner on your lap, or I don't know, you sat down maybe with a laptop and you go to get up, you've got a laptop in your hand and you're getting out of the chair, and you're probably doing it something like this, right? Which is incorrect, increases the loading on the lumbar spine. If we're doing that, but we're still messing around with a 5 kilo squat and we're finding it's easier and easier, our rehab has ceased to be effective. In the early stages of rehab, we need to gain technical competence. But once you've gained technical competence, if you just sit with technical competence, this is a very, very common mistake. If you sit in that realm of comfort, you're not changing anything. You need to get the technical improvement, and then you need to progress the load. We had one of the guys, Paul, posting in the group the other day. I think he posted on the live, actually. He said, I really started to notice differences in my symptoms when I got past 30 kilos on my squats. Other people, it's 20 kilos. Other people, it's earlier, right? You don't get to choose that because you don't know what you're doing compared to someone else who seems to be getting better faster or slower. You're doing different things every day. You have different habits. You get out of bed. You don't even, all these sorts of things are different. But what you can have is this guiding star is, what am I doing on a squat or hip hinge load-wise? And if I've been doing the same 6 weeks ago, 8 weeks ago, why? Right? Is there an explanation for that? Oh yeah, well I was unwell and not pushing it. Okay, fair enough, that's fine. But if you're still only at 5 kilos, you're going to have symptoms, sorry. Right? Unless you're very lucky, things settle down and you've restricted your life so much that you're not doing anything that might aggravate it. And that, for some people, you have to do that to such a degree that it's almost like your own prison, right? And many of you guys will feel like that in the early stages of recovery. You feel like you've shrunk your life so much so that you don't aggravate your back, you can't do anything. And the idea of building resilience, as is demonstrated by what you do on a squat or hip hinge and what you've built up to, is that you push those boundaries back out again. You can start doing stuff again. Often it's a case of, hey, I went to the restaurant with my friends, over the Christmas period, and I didn't take my special cushion, and I managed it, and I don't even know how, but I'm feeling better. And by the way, my squat's gone up to 20 kilos. Maybe that's got something to do with it because 6 weeks ago I could only do 5. Right? These are things that happen time and time again. So we've got to make sure our workouts, we get the technique right first. But once we've done that, we have to start figuring out where the right level is. And some of you guys naturally and understandably are going to feel nervous about doing that. And that's where having a bit of support can help you, right? Help you get guided through the process. Also, sometimes you think you're doing it right and you're not necessarily doing it so right. And that's another factor, right? To that end, I was discussing with one of the guys in the group about the step-ups, right? The step-ups are an exercise where we are, as the name would suggest, stepping up. But I'll do it on the wobbly cushion. This is a little bit high, but it gives you guys the visual on it anyway. And when we're doing a step-up, some of you guys will stay super high, and this was a mistake that was made. We just keep our body super up and we're going like this, and we're really hammering our knee, right? When we're doing a step-up, we want to really make sure we sit back into the step-up motion, and then we're there. You shouldn't be using a step that is this high. This is too high for you guys doing rehab. You should be doing like a normal step, like on the stairs, right? And we're over, and then we come up, like that, and we sit back into the squat. I'm doing a hip hinge here, right? I'm not keeping upright with my body and hammering through my quad. Very important point of distinction that we need to make when we're doing a step up. And we innocently think we're doing it one way, and when actually there's these little modification points that need to be made so that it's a bit more precise. So hopefully that helps. Just looking through some more of these. What can we do about a forward head posture? Push it back. Right? One of the nice posture drills, this is one of the first segments that we go through, or the first exercises or drills that you go through in the program is posture drill, right? The posture assessment, and that is that when you stand against the wall, your heels should be within an inch or so of the wall, just to account for a difference in gluteal size. And then your bum is touching the wall, your middle back is touching the wall, and your head is touching the wall. That is correct head posture. You walk away from the wall, you stay like that. It's that simple, right? It's no more complicated than that. It doesn't need to be more complicated than that. That's correct posture. Anyone trying to do pelvic tucking and this, that, the other, you're getting misguided. And if that raises questions, go and watch the live that we did last week, and we talked about the x-rays. We showed you guys the x-rays on the live session. Shane kindly shared them with us in the group. And we talked at the very end, I think, of that live session. When your practitioner, your physio, well-meaning as they may be, tells you to tuck your pelvis, do this, they have no clue about your starting position, whether it is, how far away from normal it is or isn't, and how much you've just tilted it. I don't know how much I'm tilting it. Like, how many degrees did I tilt that by? Bearing in mind it should be about a 40-degree slope of the sacrum, right? Was that 20 degrees? I don't know, because I can't see. I can't see my spine. So starting to do all these tilts and this, that, the other, focus on the simple. Head over the rib cage, over the pelvis, over the feet. That's it. That's correct head posture. Now, some of you might feel some pain when you do that, and then that leads you down different roads, right? Maybe we've got some neck issues, maybe we've got some lower back issues. So those things can then be addressed from that point. But if you've got an injury, it's not uncommon for you to struggle to be able to do that. Some people with the lower back are stuck, over like that. They can't straighten up, right? But as you progress with the rehab, you'll find you can get closer and closer to straight. The antalgic posture starts to go. Why? Because tissue healing is taking place and inflammation is calming down. And so the body can naturally sit back into its correct position more effectively. Matthew says, I have disc troubles at L4. I'm assuming maybe L4-5. And now I'm getting plantar fasciitis. I can hardly walk. Is this related? It's probably related to a degree in so much that everything's just deconditioning. And you're probably standing a bit funny. You might be in that example where we're leaning forwards a little bit more, right? And if you're leaning forwards a bit more, you're always on your toes. And if you're always on your toes, you're always pressing and stretching through the plantar fascia. That might be a factor, right? It's not beyond the pale, unfortunately. Would you also recommend an exercise bike or cycling? Say 30. Exercise bike is not what you want to do with a lower back injury. Exercise bike is certainly not at all what you want to be doing in a lower back injury. As we've said with sitting, you put 40 to 90% more load through the lumbar spine. Now, the reason we say 20 to 45% is because 20 to 45% of your body weight, as opposed to 40 to 90% increase, because half of your body weight is on your spine, the other half is not. So when you sit, you're doing that. If you're sitting on the reclined bike or any of that other sort of stuff, let alone a spin bike, you're just hammering through that lower lumbar spine, hammering it into flexion. Not what we want, right? Sure, if you've just had a fresh discectomy and they've removed the disc, you might well feel nice until you don't. Not a good. We want to be staying in neutral. The bike is not that's not rehab. It's just more sitting. The rehabilitation is the rehabilitation. Spine stability, purposeful exercises. That's rehabilitation. And Jordan said from earlier, increasing the reps. We don't increase the reps. We don't need to increase the reps. It's the weight, it's the load. Increasing the reps just gets you more practice on the technique. You're not building any strength of significance. And it's very, very hard once we start moving above 10 reps to actually meaningfully improve strength, because you often find you're just working lactate tolerance of your muscles to build up lactic acid, rather than actually building any strength. And so, it sounds like we're struggling, right? In Jordan's case, get some help, get some support. You've got a program. What else have we got here? I think we're getting towards the end, guys. Hopefully this has been helpful for you. Just having a look through some of these. Holly said, why am I starting to get nerve pain on my good side? Is my body compensating? Most likely. Most likely. Understand as well that all pain is nerve pain, or mediated through the nerves. Just looking through some more of these. Guys, I think, oh, we've got one here. I've got 2 disc bulges and one is touching a nerve root. I've been scared of the gym ever since for the last 6 weeks. This is a great example. Like, back pain is often the biggest problem we face, or maybe faced. And everybody, has different perceptions of theirs. We got 6 weeks, I've been scared of the gym for 6 weeks. Some people have been scared of the gym for 6 years, We don't need to be scared of the gym. Or rather, maybe we should be scared of the gym. You don't just go to the gym. You don't just go for a walk. You don't just go for this. That's not rehab. While you might do those things, and you might do your rehab in the gym, just going to the gym is not a rehabilitation plan. That's a plan that might well backfire. Now, for some of you guys, you'll get away with it, and you'll get better. And if you do, absolutely fantastic. That's really all that matters, that you get better, right? But just going to the gym is not a plan at all. And so you need to engage in proper rehabilitation work. You need to have a plan when you go to the gym. And that's why, unfortunately, a lot of people go to the gym and they're not even effective. Going back to that stat earlier on, people that do strength training or self-report strength training, according to research in the UK, 93 and about 95, 96% of women, 93% of men, do not do strength training for any length of time. Now, what didn't get explored in that research was the guys that go, are they actually effective? Are they actually making improvements? Because as I'm going to be discussing on that article I keep on talking about, it still isn't written, but that's because I'm just trying to get it right. Because there's so much to talk about in this particular space. Strengthening, there are no such things as a strengthening exercise. You must understand this. There is no such thing as a strengthening exercise. Conversely, everything could be a strengthening exercise. Strengthening is the outcome of doing a thing in a way that results in a strengthening outcome. So for example, as we discussed with, I think, Jordan's comment, he's just been increasing the reps he's going to do on squat. That's not going to result in strengthening. It's going to result in technical improvements to a certain point, but then we're going to get nothing, right? Strengthening is something that's measured. What's the easiest way to measure that? The simplest way, the most accessible way is how much do you lift, maybe for 10 reps, right? That's the most true representation of your strength, your current strength. And it's very relevant on the squat or hip hinge to you guys because you've got a back injury. So it's specifically challenging certain tissues that are of interest and relevance to us. So it's an evaluation metric. And so you go about getting the outcome of strengthening if you first have the correct technique. Because you're not going to strengthen anything if you injure yourself after 5 minutes, right? You might be like, oh, I didn't injure my back, but I messed my knee up because my knees are going all over the shop, right? So you first establish appropriate technique. Then you carefully, once you've established appropriate technique, not just once, but you've got a good solid technique and understanding. That's phase 1 and phase 2, by the way. Then you find the right intensity, which can take a couple of sessions, right? You're playing around with weights. We've got the barbell over here, you put a couple of weights on, you've got the dumbbell rack over here, you try with a couple. We get members doing this. And then you find the right weight. At that moment that you do that weight that you could only just about do 10 reps for with correct form, without aggravation, you have not strengthened anything. You have provided the stimulation one time. The body now needs to understand whether this is something you plan on doing for the long term or something that was a one-off, like moving the fridge. You don't adapt to moving the fridge. You don't adapt to moving the sofa. You don't adapt to those other things that you did out of the ordinary. But if you start doing that over and over again, the body goes, this is the new status quo. I need to do more. Equally in the other direction, when you stop doing everything, the body goes, we don't need to maintain this kind of tissue integrity. Healthy, strong ligaments and muscles cost us a lot in terms of resources. So we'll just downgrade those because they're not being used anymore, right? And so once we start the process of providing the appropriate level of stimulation, we have to do that consistently. Then over the period of weeks of consistently applying that, we get a strengthening outcome, as is measured and demonstrable by the fact that our lifts have gone up. We can now do 10, 20, 30 kilos instead of just 5. That is strengthening. Now, can you do that with a glute bridge? Sure. Can you do that with a squat? Yes. Can you do that with any other exercise? Sure you can. But there are some that are relevant to the injury that we have, relevant to the muscles that we want to work on, and relevant to the way in which we use our bodies every day. And the squat and the hip hinge in particular are movements that fit that perfectly. For those of you guys that have lower back injury. Now, if you've got a shoulder injury, quite irrelevant, right? But if you've got a lower back injury, it's very, very relevant. And so that's strengthening, right? You don't need to be scared. But if you're just going into the gym willy-nilly, doing whatever you want, that's not rehabilitation, and that's not going to lead to a strengthening outcome. And too many people in the gym don't understand the principles that they need to apply to their training outside of the injury. But the good news is there's tons of videos on YouTube that explain this kind of stuff and help educate you guys. And obviously you've got the personal trainers in the gym that should help you as well, of varying degrees of professionalism and varying degrees of quality, just like in all manners of occupation. And I think TikTok's telling me that's come to the hour. So I'm just going to have a look through some more of the comments, and then I think we'll wrap it up there, guys. Hopefully it's been helpful for you. I do hope it has. Just have a look at some of the more of these coming in here. All pain is nerve pain, really. I thought it was more muscle burning, tingling. What I mean by that is pain or injury is mediated by the nerves, right? So when you herniate your disc, for example, right, there are receptors in there that then signal nerves that go up to your brain that tell you something happened, right? Pain is a perception of a nerve signal that comes from an injured tissue. It could also come from the nerve being hit. So for example, all of you guys can get a real world example from me. Just do it as a thought experiment. Don't do it as a physical one. Bang your elbow on the table. Boom. Now that's nerve pain, right? But so is the pain that you get when you tear your disc, when you strained a ligament, when you sprained your ankle, you experience pain. Pain was basically receptors in those tissues firing nerves that go to your brain that tell you something's injured. So that's what I mean by all pain is nerve pain. All pain is just signals that are mediated by the nerves. And so people often use the term nerve pain as if it is helpful really in moving forwards in the rehabilitation process, and it's not meaningfully. It's like, okay, cool. You experience pain in the shin, right? You experience some burning pain here, right? Is that nerve pain? Yes. Okay. Someone else experiences pain here. Is that nerve pain? Yes. A nerve is sending a signal to your brain telling you it hurts there. So that's what I mean by all pain is nerve pain. We don't need to get too, does it mean anything from the rehabilitation point if it was one or the other in that particular example? No. But people get too caught up on this. Again, going back to what I mentioned earlier, often, specifically with sciatica, people are so much in the mindset of the symptom. I've got this kind of nerve pain and someone else got that kind of nerve pain. And that leads you to just constantly trying to address symptoms rather than the injury and the problem. Taylor has said, L5-S1 pain is horrible first thing in the morning. I've been doing PT and chiro for weeks. Now, it's perfectly reasonable that that's going to be present while you're going through the recovery process. However, we want to ask ourselves, what are we doing for rehabilitation, right? The chiro is doing adjustments, probably. Manipulations, clicks and pops, that's loosening things. It's not, they could say it's realigning, but having done that kind of stuff, I would question whether that's the appropriate word. But they're helping, right? Or should be. But they're not strengthening you. So you should be doing the rehabilitation work. You should be doing the strengthening work. You should be able to say, hey, I started off doing this stuff and I wasn't very good at it and now I'm better, right? And it may be that you still have pain in the morning. So many people will experience back pain at night. And what commonly happens in those sorts of scenarios is it's basically because inflammation builds up over the night when you're not active, right? You're not moving. Because little bits of movement actually help drain the excess inflammation and fluid in this area of the lower back where you have the injury. And so because there's other factors, and we've done a whole podcast on this, so I won't then go off on a tangent because I'm already overrunning for today. But what happens is inflammation builds up in that area. And then as you start to manage and improve in the recovery process and the ways in which you conduct yourself in the evenings in particular, that can have a positive impact. You find that later and later in the night, so instead of waking up at 3 a.m., you're waking up at 5. Instead of waking up at 5, you're waking up at 6. Instead of waking up at 6, now you're waking up, like Taylor said, with back pain instead of being woken up in the middle of the night because of the back pain or sciatica or whatever the symptoms are. And it's congestion in this area. As you make progress through the recovery process, that kind of picture often happens. Now, Taylor might be picking up at the I'm waking up with back pain point. As you make progress with your rehabilitation, healing takes place. You stop aggravating the back pain on a daily basis or back injury on a daily basis. You find that the inflammation builds up less overnight. You wake up with less muscle stiffness, less back soreness, less sciatic symptoms in the morning. And that's how it typically goes. You don't unfortunately get to choose the rate at which that happens, but that's the general direction that it should be going. And you will find that that is driven by you making progress on your rehab. The adjustments that you're having are not cumulative. They're not. Generally speaking, your rehab is what is cumulative. The treatments that we have, for example, on the decompression table in the room behind me, that is not cumulative. It's happening each time. And yes, sure, if you're continuing to not aggravate the pain, then we're going to be doing that kind of supporting the healing process at different levels, right? We do some work, you're doing some rehab work, you're building on it, you're making progress, but it itself is not cumulative, right? The adjustment of, the neck or the adjustment of the lower back or whatever it may be that you're doing is not cumulatively building. It's helping you as you go through the process. The rehab is the only thing that's really cumulatively building. I hope that makes sense. Taylor said, my PC isn't over yet, but has been weeks, so I'm excited to see more progress. Really, your rehab, you should be able to say, I started off and I couldn't do a dead bug, for example, and now I'm able to do a dead bug really, really nicely, and my squats have actually come on from 3 kilos to 6 kilos. That's the answers you should be able to say by this point, Taylor. And if not, you might say, do you know what, I was really struggling with the technique on the squat, so it's kind of held me back a little bit. And you'd have an explanation and an understanding and appreciation for why it might have been a little bit slower for you, because you just really struggled more than someone else on that particular aspect. And that's something that hopefully, makes sense for you guys and helps you evaluate what you're doing, right? Because it does take time, right? There's no magic wand. You have an injury. A person that walks in with a broken leg, you say, fix it now. It's like, yeah, okay. No, obviously not. It's got to go through a healing process. And all we're doing is supporting that healing process with our rehabilitation work, with our treatments that we may be having, etc. Hopefully that's helpful, guys. Emily says, been following your back in shape program and cannot thank you enough. I'm in phase 4 and improving. Oh, awesome, Emily. That's really cool. Thanks for sharing. Yeah, it takes time. It'd be interesting to know, Emily, as you were going through the process, like when did you specifically start to feel that momentum was being made? Everybody's different. Some people, and I feel like this is almost the worst case scenario, but it's what you guys want. Some people feel significant differences in a relatively short period of time of just starting doing the phase 1 stuff, just being more aware of these things, right? Other people, it takes a bit longer. They have to, like I was mentioning with the example of Paul a little bit earlier on, we have to get to a certain load and then we really start to notice things click in place. Other people, it's very much just a gradual thing. Now, let us know, Emily, if you're still with us. Taruti has said, the hamstring region and the buttock, what would that mean? My sciatic pain moved from the hamstring region to the buttock. Generally, I would suggest that's a good thing because that would be following that pattern of centralization, so moving from the leg back up to the lower back. So that would generally be a good thing, as a rule. I don't know, I said, okay, ignore my comment. I don't know what the comment was, I'm afraid. Oh, there we go. I've noticed I can do the toe lifts, but I can't lift up my heels. I have trouble with stairs now. It's not too much one can say about that. We're not doing well, and we need to do rehabilitation work, strengthening work to make progress. Symptoms are going to vary, right? If you're not doing anything that's moving you forwards in your rehabilitation work, we don't need to read too much into the fact that things are getting worse, right? If I've got a leak in the roof above me, and every time I come in here, I keep on getting wet, well, like if I'm not doing anything to fix the roof, then of course I'm going to get wet, and people often use that as a distraction, unfortunately, understandably, but unfortunately. And so the question always comes back, and I know it sounds like, oh, well, you're just saying the same things over and over again, because that's the only thing that's really relevant, right? If you're noticing things getting worse, as long as you don't have the presence of red flag symptoms, the cauda equina, the saddle anesthesia, right, the numbness, the loss of bladder and bowel control, if you've just got back pain that's getting worse over time, well, the question is, have you been doing appropriate rehabilitation work to actually change that? And specifically, what have you been doing? Not yes. The answer to that is, I've specifically been doing this, right? Or I've been struggling with this. That's the correct answer. And it's not possible to do that on a TikTok live, right? That's the kind of stuff we help our members with. But just something to think about, guys. Like, what have you been doing rehab? If you haven't been doing anything to fix the problem, it's going to continue to get worse, or at least stabilize, maybe in the better scenario. So that's an important one, Shashira said, I'm just doing the core 5 exercises. Is it enough to be back to normal? What about stretches for the hips and buttocks? Good question. We have a playlist. You've probably seen that on the playlist on the profile page. We have a playlist of some of the core relief work that we use in the program, right? Generally speaking, the core 5 is rehab work. That's the basis, right? Then we've got some stretching work. But the focus is on the rehabilitation work. The stretching work is helpful. Using a massage gun, helpful. Towel decompression, bed decompression. These things are helpful as we go through the recovery process. They certainly are. But the rehab is the focus, right? And so we get many people that post on YouTube, on TikTok, etc., that say, I've just been doing the free stuff that you've got online. It's been so good, right? And fantastic. If that's working, great, right? But if you need more help, then you can check out the other stuff. You can send us a DM. If you're on YouTube, you can go and do a post in the comment section. Check out the website. These sorts of things, you know, you've got those tools available. You know, we didn't put that stuff out there. We don't have 1,500 to 2,000 videos on the YouTube channel. We don't have those playlists and the masterclass and all that stuff on the TikTok channel. We don't have those resources out there to not help you guys. Like, they're there to help. And they will, for many of you, they will, because we've got the feedback to prove it, right? You guys tell us, right? But for some of you guys, you just need a bit more support. You do. Emily's just said here. So Emily, member, I asked the question a moment ago, you know, when did the improvement come? And this is so important, right? For me, the big improvements came in phase 3. Adding load was a game changer. And probably for Emily, it allowed her to appreciate where she was in the context of the stresses and strains that she's putting her body under on a daily basis, right? That's really important. Cynthia's asked here, maybe next time you can tell us about your rehab process story. Which one? Which one? You know, my knee, back in 2013, 14, I had the pars fracture at L5. It's not that interesting though. I did what you guys are doing, right? I did what you guys are doing. I did the work. I did the rehab work. You know, you can read a bit about those kind of things on the website. I don't like talking too much about that because I don't know how much it helps you guys. You know, I'm doing what I'm telling you guys to do. That's the answer. What do I do? Like when I injured my knee, what do? I use everything I've got available to help me, right? So like I was using the laser a good couple of times a day, as I mentioned at the time. Joshua says, do you know what the First Amendment is? That's the freedom of speech one in the US, I believe. Please correct me if I'm wrong. Shua said, the core 5 is awesome. I couldn't walk due to sciatic pain. Now I'm back at work. That's fantastic. A great example. Well done. Lovely to hear. Super happy about that. And so many others that post those kind of comments. It's like, that's what matters, right? Gets you back, but you've got to keep doing it, right? The problem with, if you're just doing some of the core 5 stuff that you guys have seen online, is that you might not be tempted to push the weight, right? You've got to make progress on the loading front. Like Emily said a moment ago, shared with us, you know, it was the phase 3, as you start pushing the loading and figuring out how do we make our rehab change our bodies, not just improve our technique. That's where we start to make ourselves more resilient. Yes, we are making ourselves more resilient from a technical point. Learning how to move the body a little bit better from one way to another is very helpful. It is protective. It is super important. But we're literally changing the very fibers of our being when we are doing strengthening work. It does need to be maintained. If there's one gift you guys can get, either from seeing our content online or going through the program, it's that you commit to doing resistance training and making it part of your life. Not an obsessive part. It doesn't need to be, although for some of you it will be, right? I'm a bit obsessed about Jiu-Jitsu, and I've always been doing training, right? But you make that part of your life for the long term. The benefits are too numerous. They are too numerous. You've seen there was a little phase where it's going around social media earlier this year, sorry. Something along the lines of, if the benefits of doing this kind of resistance training and a little bit of cardio were a pill, it would be sold out all the time. But it requires hard work. It requires hard work. And as I mentioned earlier on, too many people in the general population have never done these things. And we wonder why we have issues, challenges in society with people not being well. Obesity, diabetes, all those other sorts of things. Tara said, joining back in shape was the best investment in my future self. It was difficult when I started, but with commitment today, I've done my personal best in phase 4. Awesome. I might add that. Oh, there we go. That's on the broadcast. That's cool. See if it comes up. I've got some of these features on the live streaming tool. It's quite cool, but I don't use them often enough. You know, That's from the live chat. You know, that's awesome. And the thing is, then Tara, Emily, for example, you commented earlier, you go back and look at what you used to do, and you say, man, I've come so far. That doesn't mean you've not got necessarily far to go. You might still have a long way to go. But you start to see the improvement. And sometimes you've been in a bit of a dark place with your lower back, with the injury, and it feels like nothing's going right. And it feels like there's no way out. But when you start to be able to trust yourself that you actually can execute these things in spite of the challenges that you've got, sometimes there are coexisting challenges, other health-related challenges that occur alongside our lower back. In spite of those things, you're able to actually take the reins and make objective improvement in these things. And then you start to see, like Emily was saying, those things helping us or making us feel better on a day-to-day basis. You start to see those effects. That's really powerful, because too many people are going around the internet or going around from pillar to post, seeing different people, and don't feel like they have agency over their own lower back. They don't have control over their lower back. And the most important thing that we talk about in the program here, and I'll kind of wrap it up with this, guys, is that you do have the control. You are the most essential part of recovering from your back injury, no matter what it is. Whether you've got a spinal cord stimulator, you've had failed surgeries, you've had all sorts of things like that, you've had injections, you've tried 101 different treatments and they haven't quote unquote worked, like, you guys have the control over it. Emily said, it's so encouraging. I was flaring every 4 to 6 weeks to the point where I couldn't walk. Now this is very rare, and the flares are much easier to recover from. Why? Because Emily's gone through the education. She's put in the hard work. She can trust herself. And she realizes that little things, probably on a daily basis, the same as Tara, will have been tripping her up. And now those things don't trip her up anymore. And as she gets stronger and stronger, she'll be more resilient to those little mistakes, those little things. You guys see me all the time. I do it sometimes a little bit to illustrate the point. But, you know, I can go around here and I'll just go and bend my lower back and pick this up over here and I'll put it over here. I mean, hey, I was just at Jiu-Jitsu yesterday for an hour and a half with people jumping all over me. And my back's certainly not in a neutral position, right? You can do these things, but you've got to build up that strength again. Right? You've got to build up that strength again. And with 2 people I know of in that class that had herniated discs of varying degrees, right? In that class yesterday, specifically. Right? Not me, the other guys. So, you know, you can do good stuff, but you just got to do the rehab work, right? Got to do the rehab work. So, guys, I hope you have a lovely new year. We'll be back on Friday, probably Friday afternoon UK time. Yeah, I hope it's been really helpful for you guys. Any of you guys that are struggling, please do, like, if you've just come into the live stream on TikTok or on YouTube, or you're watching this after the fact, if you need any more help, you can post in the comments. Or go over to the profile page, go over to the website, have a look, wherever you need to. And yeah, have a lovely new year, and we will see you guys in 2026. Take care, guys. Bye-bye.